Hi there, my name's Poppy. I'm an anaesthetic resident doctor currently working at the Royal Surrey County Hospital, and on behalf of the doctors listed here, I am presenting our multi-centre audit, Does Vasopressor Choice Influence Patient Outcomes? A natural experiment across 3 UK centres. Firstly, the background for this project. We know that catecholamine-based vasopressor infusions are routinely used internationally to manage intraoperative hypotension. Commonly used agents include noradrenaline, phenylephrine and metaraminol, which have overlapping but distinct pharmacological profiles. Currently, there is no randomised trial data to guide agent selection, meaning that choice is largely determined by institutional convention. We conducted a retrospective audit of patients who received intraoperative vasopressor infusions at 3 major surgical centres across the UK, including the Royal Surrey County Hospital in Guildford, Surrey and Sussex Hospital in Redhill, and the Royal Marsden Hospital in London. The data collected included patient demographics, operative characteristics, vasopressor use, and post-operative outcomes. Multivariable logistic regression was performed to adjust for measured confounders. We analysed data from 323 patients, including 100 from the Royal Surrey, 123 from Surrey and Sussex, and 100 from the Royal Marsden. We found that first-line vasopressor choice varied markedly between sites, with 96% of patients at the Royal Surrey receiving phenylephrine first line, as demonstrated by the blue bar here, 93% at the Royal Marsden receiving metaraminol first line, as shown by the orange bar, and Surrey and Sussex demonstrating mixed practice, with 56% receiving phenylephrine and 40% metaraminol. This became the foundation of our natural experiment. Other important findings were that the patients at the Royal Marsden were found to be significantly younger, with an average age of 60 years, and a greater proportion of cases were elective, at around 90%. When looking at post-operative complications, we found that overall rates were substantial, with infection occurring in 25%, AKI or acute kidney injury in 10%, and in-hospital mortality reaching 4%. Interestingly, we found that the AKI rates followed a gradient aligned with institutional metaraminol use, as demonstrated in the graph on the right. Confounding of this finding operated in opposing directions. The Royal Marsden patients were younger and more frequently elective, but also underwent longer operations and more abdominal surgery, which are risk factors. Overall, we've shown marked inter-institutional variation in intraoperative vasopressor selection and identified a correlation between metaraminol usage and post-operative AKI rates. With a small sample size, this study is insufficiently powered to draw definitive causal conclusions, and the risk of unmeasured confounding is high. However, these findings provide clinical equipoise, baseline event rates, and sample size estimates to justify a prospective randomised trial examining whether intraoperative vasopressor choice influences perioperative renal and other outcomes.